Hello, this is Dr. Lewerenz from Longevity Health Institute and Lewerenz Medical Center. This evening I thought I'd share something with you that is something that I probably haven't touched upon or spoke much of, but something I firmly believe in, that I share with my patients. I happen to share with one today that was struggling with some cancer risks. She herself didn't have cancer, but cancer risks because her relative has cancer and her sister might, and being worked up for some cancer. And she told me this lineage in her family of all this, what she believes a lot of genetic risks in that with cancer. So she was obviously very distraught and very serious about being screened and being in a well position and being very preventative. And obviously that's what we do here and what we do in our wellness personalized practice. So the short though of it is, to make this sound shortly concise, is in our systems effect. In our functional medicine personalized effect, what we do is we look at systems and we consider things like hormones, gut health, diet, toxins, how you detoxify, structural issues, stress effects, mind-body stressors on the body. But one of the six of the systems, the sixth system that I always concentrate on and focus on is genetics. And yes, genetics are significant, and we do genetic testing, and I think genetic screening can be very helpful. The key word is helpful. It does not mean an end-all be-all. In fact, studies show that you can have genetic influences and genetic SNPs that will never express themselves, okay, ever. So that means that how you live in the environment that bathes those genes are what could potentially give you a cancer or give you a disease, okay? And this is well known in many conditions, even Alzheimer's, cardiac disease, cancer, etc. You can have SNPs and have mutations and have genetic traits, but they do not always express themselves, okay? So there's a thing that is called epigenetics, and that is the influence on the genes. And I'll call it the environment that gene's in. That gene is bathed in things like hormones, inflammation, nutrients, environmental toxins, many things. But I firmly believe in effects on the genes, and this is scientifically proven. Multiple studies on this. Bruce Lipton, a PhD, does multitude of studies. Dr. Lipton is very, very bright and has a clinic that's based on epigenetics and on genetic influences and stem cells. And it's amazing, his findings. But this is a thing that I like to share with my patients because it's so true, and I see it day to day here in certain conditions, and sadly in cancer. It's a very, very remarkable thing. And that is your beliefs. How you believe in your mental mindset and your approach to things in life, positivity, negativity, okay, have huge influences on health and your genes. So there's studies on this. The way you think, if you're positive or negative, can positively influence genes. And if you're thinking negative and have negative emotional, just like stressors and consequences like that, often can be negative on your genetic effects. This is very important. It's been proven in science, okay, and even in stem cells. And the analogy I like to give, I'm big on analogies. I love to educate my patients, so I'm big on this. The analogy I like to give, and most of you even out there, it's well known, is a studied scientific thing that's called the placebo effect. The placebo effect is if I give you this red pill and I say to you, this pill is amazing, it's a new discovery, and when you take this, you're going to have many anti-aging benefits. You're going to have tons of anti-inflammation. You're going to have tons of energy, huge amounts of wellness. You'll notice it in a week or two. We're going to recheck you in 3 months. It's amazing. Take this for 3 months and we'll talk. And you take this. If I gave that to 100 people, 30% of those people in studies will actually get symptoms that are similar to that. We'll report benefits. We'll have energy. We'll feel well. And we'll actually get some improvement in their health. 30%. Studies show placebo effects are about 30%. Okay? But there's also something called the nocebo. And the nocebo effect is very similar to the placebo. It's just the negative. If I did that same thing with a sugar pill, a pill that had nothing in it, and instead of telling you the positive things and the things it can do positively, I tell you the negative things it can do, and this is really not that great for you, or it has a negative component to it, it will give you negative results. So when you think and believe in positive outcomes and positive things often happen, and they influence that. And if you're negative and you have negative thoughts and energies and all that, often negative things will happen. We all see this in life, in day-to-day life. We often see it in health. And I will tell you my practice, when I have a negative, stressed individual or family that come to me for help, it's one of the first things I often want to bring up to them. And whether we divulge and get into it with some counseling, or we refer them out to some deeper cognitive behavioral therapy, or get to root causes of things, that's where we're really going to help them, and where I would say the rubber hits the road. You can't ignore your energy, negative environment, and influences. You cannot ignore that. And being positive and having positive things around you and energy around you and influences around you and good things, good people, just like good food, it feeds you. It's good for you. So keep that in mind. Keep that in mind. And the reason I stress it is we do genetic testing, and I really believe in it. And actually, as the years and decades go by, we're getting better and better at this. And so we can get some insight into, is there Alzheimer's risk? Is there cardiovascular risk? Is there potentially autoimmune risk, which is often related to detox? And we can kind of unpeel that onion and get some insight. But it means nothing at all whether you have that gene or not if you're not going to approach a environmental influence and how you live and how that gene is bathed. So hopefully this gives you some insight into genetics and what we call epigenetics and those influences, and how you think, and being positive and being happy and being grateful, being thankful for many things in your life, all your blessings. There's no perfect, okay, at all, but you can be grateful for even the breath you have in your lungs, in the world that you live in, and the people you have to love and love you and be around. And it's a wonderful thing. And you need that in your life, and need that gratitude and appreciation, because that will help your health and help others around you. So again, I hope this is a little educational for you. We always are here to help. Longevity Health Institute, Lewerenz Medical Center. You can find us on Facebook, the web, 248-289-6643. LongevityHealthInstituteInc.com. With 2 locations, opening one in Bloomfield soon on the west side, and doing wonderful things for people, and mostly bringing you health and wellness on a personalized level, but also giving you the information and educating you into this new paradigm of wellness medicine. So be well, Dr. Lewerenz. Take care.